FrontRow-3/Captain Cargo.
This is KTN News.
Welcome back. You're watching the Front Row. Let's take a look at some of your views, even as we continue with this conversation on the state of mental health in the country. On Instagram, actually, I've gotten a message on Instagram from Amina Mude, who says that she loves that mental illness is being talked about. However, I feel like there's a huge conversation that people are not having. Mental illness, specifically depression, anxiety, ADHD being caused by poor eating and lifestyle choices. Research is linking poor eating habits with rise in cases of depression, and diet is also being used to treat mental illness. Keto diet is also being used to treat people with depression. So we'll be hearing on how our lifestyle and eating habits, on whether they affect our mental illness. Let's take a look at what we have on Slido. An anonymous person here asks, where can I get help on counseling services in Nairobi? We'll have our guest answer that. Michael Wanaoni, is there a plan by the Ministry of Education for guiding and counseling to teachers and students who lost their loved ones to COVID-19? Mago has said learners should start CBL in Nyumba Kumi, yet they are stressed. And even stigmatization will increase the level of depression. This issue needs to be addressed. And I think I'd start once again back to Professor Elkoya Twoli, back to the recommendations. We are seeing that part of the recommendations, you're calling for mental health education in the curricula in all levels of education. There's a question here on then, how then do we support students who are going back to school after this pandemic? And also you can respond on whether our lifestyle and eating habits contribute to our mental illnesses.
The things that we are recommending, and recommending very strongly because the evidence out there is that it is helpful, is that we need to introduce mental health as early as possible. So, I mean, using age-appropriate language, we can introduce mental health concepts right from the time children start going to school, because there are issues about being self-aware. There are issues about knowing how you feel and being able to express your feelings. There are issues about monitoring your own thoughts and knowing which thoughts are useful, which thoughts hold you back, and so on. And all these things can be taught at any age. There are issues around identifying when, what you thought was just usual stresses of day-to-day life start becoming distress, and points where you can no longer handle it on your own and you need to speak to someone else. And even beyond that, points where you now need to speak to someone who has specialized skills to help you cope with whatever you're going through. This can be taught. We can also teach in schools about being kind, Ogola here has just said about how Kenyans are bullies online. And it doesn't take much to be kind. It doesn't take much to be nice to people you have never met. Everybody's going through something. And if we start very early in inculcating values in our children about respecting other people and treating people with dignity, because they're human, not because they're like you, not because they speak the same language, but for the mere fact that you're meeting another human being, treating them with respect. These things can be taught. And if they're taught in schools, then we will start bringing up a generation of people who are more caring, of people who feel it is cool to treat other people with dignity, people who feel it is not cool to insult random strangers that you meet, even if it is online. So this can be taught. So including mental health in our curricula is one of the biggest things that we can do. One of the biggest things that we can do in our efforts to improve the mental health of our people is getting our children to become familiar with mental health. Now, as we go back to school during this COVID season or after COVID, there are certain things that must be put in place. And if those things were in place before, they would be a lot more helpful in this season. And some of those things include having services that take care of the mental health and psychological well-being of our teachers to begin with. Because teachers have to deal with things, some of which they're not prepared for. They have to deal with children who've lost their parents. They have to deal with children who are sick and recovered. And they have to deal with children who are coming from places where there's a lot of anxiety and uncertainty about COVID-19. So teachers also have to be prepared in order to be able to deal with this. And then secondly, as we prepare to bring our children back to school, we must have a lead-in period where the teachers are prepared to help the children to deal with the psychological distress that is coming from this pandemic. And therefore, it might even be necessary at some point for us to have simple guidelines for teachers on how to help children who are coming back to school when we reopen during this COVID season. And that is going to be absolutely necessary. I think on the question of diet, which somebody asked about whether diet has anything to do with mental health, I would say that mental health is part of health. And we say for you to have a healthy mind, you also need to have a healthy body. So you need to take care of yourself physically. You need to do exercise. You need to have a balanced diet. You get your energy from food. You get your protection from food. And so watching what you eat, following the advice of nutritionists about how much of carbohydrates you should take, how much starch, how much vitamins and so on, and protein is important. And so when you have an imbalanced diet, it affects the physical functioning of your body. And further, it has effects on your nervous system and the brain. And that then will manifest as behavioral symptoms of mental ill health and might manifest as distress that you need to correct. And so diet has a huge role to play in our general health and also our mental health. Things that you eat are the things that affect how you feel and how you behave. If you drink alcohol, it affects how you behave and how you feel. If you do not get enough energy from your food, it affects how you feel and therefore how you behave and so on and so forth. So diet is important, everything in moderation, balancing your diet. That same old primary school advice that we got, following it is good for your mental health. Additionally, simple things like taking brisk walks every day, a brisk 25 to 30-minute walk every day keeps your body in shape and helps your mind then to prepare for any adversity that will come. Getting sufficient rest, being able to sleep at night. I mean, people talk about a certain number of hours. It's not the number of hours, it's the amount of restful sleep that you get when you wake up and feel rested. For some people, that will be 6.5 hours. For some people, that will be 8 hours. But for most people, it is in between there. And if you get enough sleep, then you're energized and your mind is ready to face the challenges on the next day. Even if there's a calamity going on, you are better prepared to plan and organize how to deal with it. So there are many things we can do. Most of these things can be taught at any level of educational institution, and we think it is absolutely necessary to start thinking about incorporating mental health in our school curricula and syllabuses at all levels, from nursery school all the way to university.
And apart from education, Dr. Shiba and this task force really did a job on very many sectors in our lives, in the country, from education. Let's go to the workplace. This is another place or area where people are crammed in their spaces. Now we're dealing with a lot of things. There is a recommendation for employers to also create an environment that is cognizant of people's mental wellness. What are your thoughts on this?
The creation of, at the workplace, maybe I didn't get you well. Would you mind repeating what you want?
At this point, when we're having a very big conversation around mental health, let's talk about mental health in the workplace. What should employers do to support their employees' mental health status, perhaps?
They should actually avail the services within the working place, especially by engaging counselors or psychologists, and especially the ones who can actually assess their mental status. That is very, very crucial, because if you are sick or maybe you have a pre-existing condition, and it is not checked, that is going to worsen your mental status. So it is always good if the employers actually engage counselors, psychologists, and even psychiatrists that can prescribe for those mental illnesses other than just not being supported. That one is very, very important, something which is lacking in most of the organizations or in most of the working places. So it would be very good if every working setup has got those facilities for caring for mental health.
Dr. Gitao, there's a, yes, thank you, Dr. Okumu. Dr. Gitao, there's a question I'd like you to respond to here, and it's on our Twitter platform. Someone asks, are mental health illnesses preventable? That is Franklin Yano on Twitter.
Yeah, I actually would like to say very confidently that mental health is preventable. I am actually a child of a father who battled mental illness for over 26 years. And I know, like Prof has said, that can we have preventive measures? Can we build resilience in our children? Can we build mental health capacity for teachers? Because teachers are the second parents. Because you may have dysfunctional parents, but when you go to school, are you finding functional teachers? When you go to university, are you finding functional lecturers who can, even if they are not counseling psychologists or university counselors, help you? I know in this nation, we have very many professional bodies, but it's one of my saddest moments whenever I remember that we do not have a united national front in this nation that can come together, a body of psychologists, a body of counselors. Psychiatrists, they do very well. We also have medics doing very well, medical doctors. But for us, psychologists and counselors, we cry every day because right now, some of us have been forced to actually approach companies. Like there's an app coming out very soon called DocCU, that any Kenyan that needs to be helped online, they just need to download that app. Why? Because if there is no organized system of Kenyans approaching any counselor whenever they need, they're gonna do it like the way we look for Uber services. This country, if we think of mental health, we are either thinking of Red Cross or we are thinking of AMREF. Seriously, we need to be, even when we mention the mental health directorate, we are able to. I know right now I'm working closely with KMTC counselors, and I say, you can imagine if they are operating, and I am one of those Kenyans, I don't have to be paid to actually work or wait to be paid. Because you can imagine every plane that is landing in this country, the first place they are going to is KMTC. And we have seen issues that have happened there. So what I would like to say is that a lot needs to happen in this nation. We need to speak and speak and speak again and again. And thank you so much, KTN, because I think the way you look at this topic, it's like you have an idea of what is happening in this nation, because you don't even give it 10 minutes, 5 minutes. You're giving it a whole 2 hours that we can discuss from experiential point of view. We can discuss from the comfort of our homes. We need to talk and talk and talk. And I want to tell you, Akisa, what is happening at the family level, what is happening in the residential places, as much as we are not talking about step one that the government has taken, step two, and I'm not blaming the government because I'm part of the government, but what I have a problem with is when people don't have systems working, you end up working harder, and sometimes you end up messing up. Who are the people providing professional counseling services?
Okay.
At least as a psychiatrist, you will get to know them like that. But who are these people who are providing professional counseling services? Who are they?
Okay.
If you're told get one, that's why somebody is asking, where can I get counseling services in Nairobi? Can you imagine the city where we have the majority of mental health practitioners? There is a Nairobian who does not know where to. Does that ring a bell in this nation?
Dr. Gitao, we don't have too much time. I'd like you to give us your closing remarks as we wrap up.
So I would like to appeal to all the healthcare providers, and especially mental health care providers. Join us every Sunday on a wellness platform. I keep posting it on my YouTube account, on my Facebook account, On my Twitter, Dr. Susan Gitau, we want the helpers. We don't want to hear people like Philip saying, I got out of this on my way to help Kenyans, and then I was hit badly, and Kenyans never understood. We want to work together, and there is something that I call mindful self-compassion.
Thank
If
you.
you feel you're
Dr. Gitau, I'd like to give everyone a chance to give us their closing remarks. Thank you. Philip, on to you. And I'd really like you to especially speak to young people, and especially those on the social media space that you say has become very vile.
Thanks so much, Adisa. If you're a young person watching this right now, picture this. Our health workers right now, they are strained, they are burnt out, they are fatigued, they are mentally, physically, and psychologically burnt out. So most of the health workers who have interacted with do not go online because of the toxic posts on social media. These youngsters post on social media that COVID is a fake, is a government propaganda, yet our health workers risk their lives every day. So you find our health workers don't go online. Our patients don't go online. People with mental issues don't go online because of such toxicity. I'll tell you for a fact, social media is becoming a toxic space because of our youngsters who do not value ethics on social media. So I think mental health is a communal effort. We need to all come together, from parents, religion. I really want to talk about religion. I went to a church and I was told by a pastor that they could pray for me to heal my mental illness. You cannot treat mental illness with religion alone. You need a community effort, hospital treatment, and even friendship support. And I just want to tell guys who are online and the media to let's spread positivity. During this COVID period, let's focus more on recoveries. Let's tell the positive stories of recoveries. Let's not focus on the negative, on the death. Let's not share death images of the dead. It could be you one day. Would you post a photo of your mother? Would you post a photo of your son? So I just want to let you know that mental health is real. And please be mindful of what you post on social media.
Thank you very much. Way to end that. Dr. Shiba, let's get your closing remarks in under a minute.
Yeah, I want to remind each and every person that everybody needs a shoulder to cry on, because we go through a lot of losses, go through a lot of anxiety, and everybody needs to be cared for. So we should be aware of where you can seek the help, especially of releasing the pent out emotions. That one is very, very important, and that you can do through different coping mechanisms that you can only get from the counselors or from the psychologists. So let us not take mental health as a plaything. It is a serious thing, and it affects almost every person.
Right.
Let us focus on actually looking for the symptoms and creation of awareness on where the people can get the help.
Thank you very much.
They are there.
Thank you. Thank you very much, Dr. Okumu. My apologies for cutting you short. We are really running out of time. Chebet, I understand you're still with us. Perhaps in like 30 seconds, give us your closing remarks, then we end with Prof.
All right. For me, I have 4 very quick pointers. One, let's end the stigma around mental health. A lot of people are dying. A lot of people could get help, but they can't reach out because of the stigma. They're afraid because you will discriminate against them. Second, I would like, if you know anyone who's suffering from mental illness, support that person. Let's have family and friends who are supportive. I would not be here if it were not for my friends and family who supported me. So let's support people with mental health issues. The third thing is, if you're going through depression or if you're on your way to healing, get a new hobby, get something to do so you can find meaning in life again. Find a way to release, like Dr. Atwoli said, exercise, do something, just do something with your life so you can get meaning in it. And then the last recommendation that this I would give to mental health practitioners and psychiatrists and people in the medical field: involve your patient in the treatment options. Even if they lack insight, mentally ill patients actually need that insight. So you are the person to show them that insight so that they may be able to recover quickly.
Thank you very much, Chebet. I'd like to wind up with Professor Twoli. There's a question that I'd really want you to quickly respond to. What can someone do if he can't understand why he is having anxiety? And as you give us your closing remarks, give us a way forward, and especially on issues to do with cost and access of mental health care.
So I think, if you have anxiety that interferes with your usual functioning, you are unable to interact with your family, your friends, your workplace, then it means it has already overwhelmed your ability to deal with it on your own. And therefore, you need to look for professional support. The way the system is supposed to be set up is that if you meet any mental health person, indeed any medical person, they should be able to figure out that there's a problem and to direct you towards help. So don't be afraid to go and ask, is what I'm going through normal? And we have the capacity to tell you whether what you're going through is normal or whether it requires further assistance for you to be able to deal with. So I would urge anyone who is experiencing things that they do not understand about themselves or about their environment to go to a medical person or preferably to a person with training in mental health and just ask that question. Say, I'm going through this and this and this. Is this normal or do I require some assistance? And you will get help.
Right.
As far as cost is concerned, I think it is time that we invested as much resources in mental health as we have invested in other things. Mm-hmm. We have invested a lot in physical infrastructure. We have invested a lot in our security forces, in police and so on. It is time that we invested in mental health. And to start us off, the government which we elect and which we give our taxes must guarantee access to certain mental health services. And then the rest of us can work at topping that up. So firstly, we must have access that when I have a mental health emergency, I can access the highest available quality of mental health care anywhere in the world. And that is possible in this country.
Thank you.
My closing remarks.
Yes, quickly.
My closing remarks, I would say this, two things. One, there is absolutely no health without mental health. Absolutely no health without mental health. Let nobody talk about health or a health system without talking about how they're addressing mental health. Mm-hmm. And secondly, and perhaps almost more importantly, I want to ask Kenyans to try to reach deep within themselves and find it in themselves to be kinder people than they are today. If all of us try and be kinder to the stranger that we meet in the street, the stranger we meet online, the stranger we see on TV, this country will be a much better place than it is today.
Thank you very much. Thank you very much. To close it, there's no health without mental health. And we close it at that point. It's a conversation we'll keep having. To our panelists tonight, Professor Lukoye Twoli, Dean of Medical College, Aga Khan University, and Professor of Psychiatry, Dr. Shiba Okumu, a clinical psychologist, Dr. Susan Getao, counseling and trauma psychologist, as well as head of Department of Psychology at the Africa Nazarene University, Philip Ogola, digital humanitarian, and Chebet Birir, journalist here at the Standard Group PLC. Thank you very much, ladies and gentlemen, for joining us for this all-important conversation. I'm your host, Akisa Wandera.